quickly. If you don't, then there's a problem. I have another case here. He is grade 9 student. And he coming with a suicidal thought. And then the parents coming, send him right away. He says like, I just don't think I can go on. I feel like my life is the end. I just want to die. And I say, okay, listen. Now, I feel because of my TCM trainings, I can see the face complexion really shallow, right? And what does that mean? From the TCM's point of view, it's like your lack of blood. I'll talk a little bit more there, okay? But in a Western point of view then, it's something I suspect maybe he is low in iron, right? So I say, you know what? Just hold that thought, because he actually doesn't want to die. All right? He just feel like what happened is both his parents are very outstanding, right? And then he feels like I need to be good, I need to study well, I need to get my whatever. But he has no energy, tired, very depressed, and he's like, I don't know, I just cannot remember things. Okay? So how is he going to be well? No, he cannot, right? And I say, you know what? Let's put it this way. What about you go do a blood test first? Okay, you go do a blood test and then just see how it goes. Okay, and then both the father is really good in math. Okay, he's very rational. If there's a problem, let's deal with it. Okay, so they quickly go to the blood test. Guess what? Very low, very dangerous low, 3%. Okay, and then you could you could actually faint very easy, right? What happened to your iron? You ironed in your blood, they actually bring in oxygen, right? Okay? And what oxygen does to you? Give you energies, right? So that's why he always feel like, I cannot move. Well, of course, you don't have enough oxygen, so, right? Okay? So if we only treat him like, oh, you're so depressed, what do we do? Okay, and we do all our level 1, level 2, level 3 suicidal assessment. Is that going to help?
No.
Maybe not. Okay, so after he knows and the parents knows there's iron deficiency, and then they go, I work with a holistic, GPs and other people, right? And then we work together as a team, and then so get his iron up, and he feels like, oh, what a difference. Okay, now I can probably keep going. I don't want to die now. Okay, so the reason why I share the cases with you is I want you to open up your mind and see bigger. Okay, you don't do the blood test, you don't have to, but this is your responsibility to have recommendations. Maybe talk to your GP, right? Maybe do a blood test, and then come back, you have a bigger picture. Then you show them cognitive way to improve their behavior, right? Because otherwise you will never find a root. Does that make sense to you? Okay, very good. Okay, so next one, so what do you say? Enter. Yeah? Should I press enter? Okay, good. So enter. Oh, there you go. The computer like enter. Okay, good. So we're going to talk about just the major depression disorder. What does that mean according to DSM? Is at least 2 weeks of depressed mood, and the loss of interest, and accompanied at least whoa, I didn't even touch it. Okay, the computer is very happy today. Okay, so at least 4 other additional symptoms of depressed feelings. Right? But you have to have at least 2 weeks and more, right? If one day, you just don't feel like, something happened and you feel sad, it doesn't, put you into depression, okay? You feel depressed mood, we are allowed to, right? Because we're humans, okay? So depressed mood, most of the day, every day, and then there is whether it is subjective or objective, okay? Right, the next one is you have the weight change. Okay, so that's in depressions. The reason why I want to show you the difference from DSM is because I'm going to show you TCM. What happened, right, when TCM? So, but first you need to know what happened in the regular people give you something, say you're depressed or you feel depressed, okay? So, you have a weight changed. Right? And then for the kids, it's like weight change, meaning you can get big or you can get small. Okay? So that's 5%. And then you have insomnia or hypersomnia every day. And then agitations or retardations every day. And fatigue, lack of energy. Does it sound right? Right? People, if they feel depressed, but not everybody has it. But you have to have at least 4 and above. If you just have 1, no. Okay. Not yet. Okay. Something is not right, but it's not there yet. Okay. But this is the feeling parts. Feelings of worthless or diminished ability to think, concentrate, or reoccurring thought of death. Right? Okay. So that's the definition from DSM. So, or suicidal thought, whatever. And then there's another complexion here is, okay, sorry. So this one, and this behavior has impacted your socially, occupationally, or other events. But this feelings it's not because of bereavement, someone died, okay? You're supposed to feel not happy, okay? So that doesn't count like you have depression. It's just because someone died, right? And what else? Longer than 2 months or... Okay, so any question for this one? No question. So this is just a definition, okay? Now, anxiety, again, we want to see what happened to anxiety. Anxiety has 30 different types, right? And there's anxiety disorder. But to your surprise, so many people may know, may not know, but panic attack and agoraphobias or panic attack, whatever, special phobias and social phobias, these are anxiety, right? Anxiety has many different kinds. If they come to you and say, I feel anxious, which one, why? Right? So you don't generalize it, right? And then most clients or patients, they don't know. They don't know. When I teach in the holistic medicine school, I want the student to know. Like in one of the class, I want student to know. If your patient come to you, they say depression, anxiety, you need to know a little bit better than they do, okay? Because they use this word a lot. Right? And then you don't know what does that mean, okay? I have, one time I have, when I do seminars, I have a client and he says like, Peggy, if I'm afraid of my wife, does that count as a special phobia? I say, yeah, okay, talk to me later. Because wife is there. Okay? No good. Okay? Maybe. Okay? Okay, next one. So, OCD. You heard about OCD, obsessive compulsive disorder, anxiety, right? But some people, they come in and post PTSD. PTSD is very tricky. So now they don't want in the occupational trainings. They want to change the name. Yeah, they want to change the name to PTSI. Oh, they don't want to be seen as a disorder. They want to be seen as an injury, right? But they try hard. But the problem is the national organization still prefer PTSD, okay? So just be aware, there's a PTSI, if you heard about that, right? It's an injury. Because the public safety personnel, they don't want to see being disorder. They want to be seen injured, right? That's very normal if you're injured, okay? Now, acute stress, or general anxiety disorders, and anxiety due to general medical conditions and substance use, and anxiety otherwise not. There's a separation anxiety and sexual disorder that's not considered in this part. So when we say so far so good, yeah. If someone has a thyroid problems, yeah, what happened to thyroid or heart condition? Oh, there you go. Very easy, right? Very easy to feel anxious. Does that make sense? Yeah? If they are hyperthyroid, very easy to feel anxious. If they have like a heart condition, very easy to feel anxious, right? So the talking parts is not going to help them. It will help them to some degree, but not help them to complete. So you cannot just say, you just need to come to the counseling or just go to the therapy. It won't work, right? Because of the body condition. I have a patient coming, and then he says, like, I've been feeling anxious for a long time, ever since I was born. Okay, and then so I would do a holistic assessment, and then it turns out he has a type 1 diabetics, right? So type 1, what happened? Type 1 and type 2. What's the difference? Yes? That's right. So Type 1, you're born with it, right? Type 2, you develop that. Okay, all right? Okay, so but any type, right? You're worried. Your blood sugar is going to drop, right? Will you feel anxious easy? Yes, that's right. And then so if you only work on I feel anxious, but what happened? I don't know my body, right? And but once our body is regulated, the anxious level is also lower, right? Does that make sense? So far so good? Excellent. Okay. So now, next one is panic attack. We'll just quickly talk about what panic attack means. Like, because anxiety, many people come and say, hey, the other days, I just have a terrible panic attack. And then they come to you, right? And then so you will say like it's anxiety. But what does that mean? What does that give them, that panic attack feelings, right? Palpitations, physiologically, a lot, right? This is a DSM. This is how they categorize. Palpitation, pounding hearts, and then sweatings, tremblings, sensations, feeling chokings and chest, nauseous, and feeling dizzy, right? In TSM, it's very easy to explain what happened, okay? And then, but when people have panic attack, this is how they feel, right? They feel like, okay, right? But nobody has that, right? And then so, what else? It's like, this is more like your feeling parts. Your derealizations, fear of losing control, some fear of dying, and then numbness, and chill hot flashes, right? So this is the definition from DSM, but you see, it's very physiological based, right? Okay, panic attack, what do you mean? Oh, I have this problem. Bless you. Okay, so but in TCM, very easy to tell you what happened, because these conditions all very related to, Muhammad, what is it? Related to what part?
Heart and liver.
Yeah, okay.
In TCM.
In TCM's point of view, this part I will explain a little bit further, okay? Very easy, like in the heart condition, right? Okay, heart meridians. And heart meridians. If any part with a heart, pericardiums, your livers have these conditions, very easy. And I'll show you. I'm not saying that, so but I don't know about meridians. That's okay, I'll show you, okay? You're not going to leave it without knowing. That's right. Okay, next one. There you go. So far so good? Yeah. Everybody, any questions? Anyone need a little break to go to washroom? Yeah? No? Okay. Let's go into TCM. So right now, TCM, we're talking about, TCM has many different layers, but I won't have enough time to tell you every layers, right? But I'm going to tell you the basic foundation. Qi, blood, and fluid, right? Many people here, if I heard many people, you go to TCM, but TCM has very basic foundation, so yin and yang, right? And our job as a therapist, whether you are acupuncturist or clinical counselors, you're looking for balance. Correct? Right? Anyone think or feel you should be happy all the time? Do you need to? No, right? Okay, nobody will, right? Nobody need to. Who says happy is the only feeling? No, right? But when you feel angry, when you feel sad, when you feel resentful, there must be a reason. And I always tell people, same event happened to 10 different people around them. 10 different people has 10 different feelings. Correct? Right? Any feelings, there's no right or wrong feelings. It's just because of where you're coming from. What's your background, right? So you feel a certain way. So first, we don't judge them, right? And then we want to know, why? Why do I feel this way? Because I remember in February this year, we still have a snow, right? So how do you feel about the snow? You happy? You're sad? You're what? Snow? Right? Some people are like, yeah, snow. But it's the same snow, right? So there's no feeling is right or wrong. But if this feeling is impacting you, then it's something you want to know more, right? And then your therapist will help you. But here's the thing. Well, from the TCM's point of view, yin and yang, what does that mean, yin and yang? Many people see this simple before, correct? What does that mean? Okay, there's a meaning for that, okay? So the white part is actually more like a yang part. And what does the yang part mean? Mostly positive, male, day, active, sun, logic, hot, and hard. right? Okay. In your life, you always see this yin and yang, right? And the yin part is what? Negative, female, night. Well, don't get me wrong. It's not about females or negative, okay? don't get me wrong. It's just like a females. We're more the yin part, right? We are like a soft, right? It's soft. So and the yang part is more like a male part, right? Okay. And then positive and night and moon and intuitive and cold and soft. These considered yin part. Okay. Do you see what happened? Is when the people feel depressed, which part is stronger? Huh? Which part? That's right, because it's too much. Right? When people are anxious, very easy to get angry, like, energy's out. Which part? There you go. Very good. So, in general, they're off balance. Right? In our body, everyone, you have yin and yang part. All of you, right? If you're generally okay, means you're balanced. But you will off balance, I guarantee you. Okay? And I said, what? Okay. But it's very normal. Nobody's always balanced all the time. Okay? You need to remember. But it's not about how much stress you got. It's how much you can let go. Right? You can be off balance. You trust me, you'll be off balance. But how fast can you come back to the balance? Right? That's your resilience. In the counseling, we always talk about resilience, right? But at first, you need to remember, it's a norm that you were off balance. It's a norm, right? In a day, right? We have a day. If we say yin and yang, yang is the daytime, yin is the yang time. In the summertime, especially in Canada, is it obvious, right? In the summertime, oh my God, the day is longer, the yin is less. Right? And then, but in the winter time, yin is more. So many people feel so deep down in the winter time. Okay, right? So in TCM, our job and your job is very easy. If it is yin too much, let's put in a little bit more yang, right? If yang too much, and then give a little bit yin. It's all about a balance, right? Same thing, like in TCM. Is that so far so good? Yeah. Making sense? Okay. Any questions? Right? I'll tell you, in the whole life, this time is working again. Oh, good. Okay, so qi, blood, and fluid. Okay, what does that mean? Qi is the yang part, because the yang push, right? Blood and fluid, they're obviously the yin part, right? So inside your body, there's already yin and yang, right? But imagine, so I'm going to show you. Well, so what does that mean by qi? Or ki, or people just, spell different way, right? What does that mean? Do you believe in that? Yeah? Okay. Can you tell me what's qi?
It's energy.
It's energy. Okay. What else? Anybody believe in qi? And what's your definition? Yes, Navneet?
It's your life force.
Yeah, life force, so deep. Thank you. Anyone else? Do you believe there's a qi? Yeah? Okay. So I need someone to help me to read this out loud. Someone can help me, please? This gentleman there. I like your shirt. Yes. Very Hawaii-like. Okay. Yes. So what's the qi? Go ahead.
Qi is the classic Chinese philosophy. Wait, what?
See?
The classic Chinese philosophy believes that primary state of the universe is qi, the constant movement of which produce all the things in the universe, including life. Thus, people in ancient China thought that the accumulation of qi would produce life, while the dispersion of qi would put an end to life.
Perfect. Thank you very much. Okay, so basically, before the moment you're born, you accumulate qi. Okay? At the end, your qi left and you're gone. Okay? So what people say, what is life? It's the breath between your first breath to your last one. Right? Okay, guys. So many people, how many people here learn Qigong or yoga or meditation, whatever? Very good, very good, very good. All right, excellent. And how many people here are counselors? Okay. How many of you teach your client to breathe? Very good. I'm glad everybody teach them. Okay, why? Okay, why are you doing that? Of course, because the book says so. Okay, say breathing will help. Yes. Okay, but here's the thing: breathing, when it is not regulated, is going to cause problem, right? From the Western point of view, Western medicine point of view, when you are anxious, what hormone is higher? The adrenaline. So the first thing is your cortisols, right? Your cortisol is in balance, and it makes your adrenaline to pump high, and it makes your heart pump high, right? Your body is very smart. If you imagine your body is like a machine, right? Your body only designed 3 to 5 minutes to have that kind of response. Why? Because imagine if this kind of response going on for 24/7 and 365 days, what happened to the machine? You break that, of course, right? Because that's okay, no good. Okay, so that's why when you breathe, if you already have a chi, right? But how do you breathe? So how many people breathe in your chest, and how many people breathe in your tummy? You learn how to breathe. What's your breathing right now? Everybody look good? Yeah? Excellent. Okay. When you have panic attack, how do you breathe? Okay. Dying breathing. Okay, good. So, anyway, and I'm glad everybody is breathing properly. Okay, and now, next one. So, what does that mean? What does the chi in TCMs, what does that mean? Because why do we teach our clients to breathe? Because there's a reason, not just because the book says so, right? Okay, now, so TCMs, the chi of the TCM teach you to propelling, warm you up, because this is the yang part, right? And then your protections, okay? Your protective chi is your immune system. And your fixating, okay? So that they can hold all your organs together, right? Otherwise, because of the gravity, okay? No good, okay? So they hold you, okay? And they transform. Transform, meaning if you eat things, if it is solid, they become something solid out. Right? If it is liquid, you're laughing at me. If it is liquid, again, they transform. They need energy to transform. Right? Okay? So far so good? This is the physiological function. And can you imagine if any of this go wrong? Yeah? Sorry, what happened to this one? Oh, blood. Oh, okay. So did I miss anything? No? Okay, so that's the chi functions. And this one? Oh, okay, we'll see. Okay, so blood functioning. So blood, so what does that mean for your blood functioning? Do everybody has blood, right? Okay, good, excellent. Can you read the first one, baby? One for me, blood. Blood. Excuse me, that's okay.
Mainly composed of the nutrient Qi and body fluid circulating inside the vessels. Blood functions to nourish and moisten the body. It is vital to the maintenance of life.
Okay, thank you so much. Okay, so we take that for granted, right? The chi, the blood, and then the fluid, and then we'll talk about what fluid means, okay? Because this is the basic functioning and understanding of TCM. And everybody has it, all your client has it. But you know, if any of that is not regulated, something is going wrong. Right? Okay. But don't get me wrong, not everybody is all regulated. Okay? So even though you're healthy, okay, I always tell people there's no 100%. Okay? 90% you're okay, you're already good. Okay? So you don't have to worry like, oh, what if this and that? No, you don't need to worry. You'll be fine. Okay? So the blood is inside you, and what does that mean? Like a physiological function of the blood is to nourish, to moisten, right? Some people have very beautiful skin. Why? Because their fluid is enough. The collagen is good, right? If people, they feel like your complex is like a pale. What happened? Blood deficiency, right? So what happened? The important material for mental activities activates, okay? If it is sufficient, excellent, good for you, okay? And then if it's deficient, what happened? Your spirit is not going to be up. You dispirit. You feel depressed easy. Because your blood is not enough, right? Because you don't have things to nourish you. How will you feel happy? You won't. Feeling depressed, part of it is because they want to tell you, I'm not happy, right? We need to do something, okay? If it is disturbed, what happened? Mental disorder. Okay? So I'll explain a little bit more what happened when you don't have enough blood. And you guess what? You can actually nourish, and today we'll give you something to help you to nourish your blood, to take home, okay? So, very simple and easy. When you eat right things, then you nourish your blood, right? Too many times, how many patients, how many clients, they come to you and say, Peggy, I'm very anxious, but I don't eat. I said, okay, so how does that work? Right? So if you assess holistically, you will realize there's a reason why, right? I have a client, and he's our public transit kind of worker, and then he came to me. He goes like, I get angry very easy, and then I have passengers come to me, and then they are very angry, and how dare they can do that? And so I say, okay, I understand how you feel uncomfortable, like because you first, as a counselor, you want to validate them, right? Because they come to you because they don't feel good, and then you say, you didn't. If you say if you don't validate them, why do they come to you, right? So validate, but then I assess what happened. First, he doesn't drink water all day, okay, and then he doesn't eat, and then he doesn't sleep. What do you think? And then he's working. Oh, okay. I always joke with my clients, and whether I say, when you're sleeping, it's like you imagine yourself as a cell phone. Okay? And I say, yeah, okay. What kind of a cell phone? Samsung. No, I'm just kidding. Sorry. Okay, it doesn't matter. Okay. So imagine your cell phone. When you're sleeping, you are actually charging yourself. Right? So if you don't sleep, your sleep has a problem. 1 day or 2 days because of traveling, it's okay. But long term, there's going to be a problem sooner or later. Right? So imagine when you're sleeping and you're charging, bless you, and then charging, and then you don't charge yourself enough, like maybe 60 or 50%. Okay, that's okay. And next day, all your apps are still running. What happened? Oh my God, my power is low, right? You feel anxious, right? Or you shut out, right? Okay, guys, very important. If you don't sleep properly, because your blood is nourished or replenished when you're in your sleep. Okay, that's the perfect time when you grow your good blood. And you're saying, but I have insomnia. Yes, okay, so we need to cut the circle. Any question for now? No question. Very good. Okay, next. It doesn't work again. It's very sensitive, right? Okay. It's only... All right. Thank you. How come every time you touch it, you're laughing at me? Okay. So the blood also moistens the vessels and the body. So what happened if you don't have enough blood? You feel dry. Everything dry. Right? Your eyes is dry, your mouth is dry, everything, your skin is dry, because the sign of your blood is deficient. How happy were you? You probably won't. Right? Okay, good. And then the transformations, transport the turbid chi. Turbid is dirty ones, right? It's the dirty ones. So to the lung, that's the reason why we want them to breathe. Because then they can get that toxic out. Right? Okay? And then to the kidney, it becomes urinations. And then to the surface, it becomes sweating. And how many counselors here suggest your patients or clients to exercise? Everybody, right? Because when you do exercise, you actually before you know TCM, right? Exercise, people say exercise to help you to move, but actually there's more than that. Right? Because when you do exercise, your left and right brains, one is chi, one is blood, right? One is rational, one is emotional. That will be in my class, okay? So I won't talk too deep, okay? So when you do exercise, you're exercising both, right? And then sweating, and then you get your good hormones up, right? And that's why you can help them to move the chi. right? Because when they are not happy, their chi is stagnated. It's not moving, right? When chi is stagnated, you know when you sit a long time, you won't be happy. Yeah? Because your chi is not moving. Does that make sense? Right? And then you will say, okay, I need to stand up and move around, and then you feel much better because your chi flow again. Does that make sense? Very good. Okay, now we'll try my luck. See if this one worked. Oh, this one worked. Okay, very good. Okay, so fluid. Now let's go into the fluid. Fluid is the basic substance that make up the body and maintaining life activities. Ladies and gentlemen, if anything you don't remember today, about TCM, please remember this one. The main component of bodily fluid is water. Okay, talk about water. I need to drink some water. Okay. So, if your clients are not drinking water, or you yourself not drinking enough water, it's going to be a problem. Okay? Blood and fluid, they are similar. They are all yin part. You will notice your clients, if they're anxious, they actually don't drink enough water. They're always dehydrated, right? Simple solution, aside from our mental work, is ask them to have a regular water intake. That makes sense? Okay, very important. Okay, and the same to you too, because if you work with your clients, when I'm in a class, my students, everybody has to do a self-care presentation because you are more important. All right? If you burn out, nothing's going to work. Okay, therapist, please remember that. Okay, and then so flow inside and outside of the vessels, and then the form is urines, sweatings, tears, and then your saliva and your droolings, right? All your fluid. They are actually everything for you. They are fluid, right? In TCM, they even go into deeper. Which fluid is related to different organs, right? Mostly tears is to liver. Okay, liver, emotion of the liver is anger, right? In TCM, they actually separate them into different categories. Okay, when you're crying, it's actually because your emotion is trying to come out, right? You don't want to stop your patient to cry, and then you want them to cry because how many people you work with people they don't know how to cry anymore? Quite a bit, right? Okay, because they block themselves. They don't know how to cry, and what happened? Everything stores inside, right? So that's why they're not happy, because the chi is stagnated, right? Okay. So the next one, this part, the reason why water is so important is because 75% or even up of your body, they contain fluid water. Okay? And imagine if you don't have enough. So brain has 75, muscle have 75, heart have 79, and lymph have 94, and liver 72. Everything is 70 and above, right? Only the bone, okay? Because bone has a different component, right? So imagine if your patient's always dehydrated and even yourself is dehydrated. What happens is the body sends a signal, anxious. Or they send a signal, mostly they send a signal anxious because they are dehydrated. Right? So start to look into the anxiety or depressions from a different angle, please. Don't just use the DSM, okay? DSM is good, but not complete, okay? So when you have this 70, that remember, ask them to drink enough water, and then if this is not enough, what is going to happen? Okay, so fluid, we have thick ones and thick ones. The thick ones is like, clear ones, the ones you see, the sweatings, the urinations, and those are the thick ones. This is more into the TCM I want to share with you. The thick ones is the bone marrows, but we don't need to worry about too much about that, okay? All right, so the next one. So the physiological function of blood fluid is to moisten, nourish, transfer the blood, and the turbid chi. Okay, so this is the function. Now, what happened is when chi, blood, and fluid, they got dysfunctional. Okay, so chi deficiency. What does that mean? Not enough, right? Your chi is not enough. What happened to this one? According to TCM, shallow complexions, fatigue, weakness, low and weak voice. Does it sound familiar? Like what? Depression, right? So it's qi not enough, right? It's your body trying to tell you your qi is not enough. And the funny thing is qi, if you rest enough, it'll come back, right? So chances are your patient is not having enough rest. Your clients is not having enough rest, right? Always also check, because too many times the people are working so hard, right? Your mind and body, if there's a connections, they actually try to send a signal to you, right? When body is not feeling well, how do they send a signal to you? Pain, soreness, right? Or whatever. And then you will say, oh, I need to go to see a doctor, because they send a signal to you, right? Your mind also sends a signal to you when they feel certain things. But everyone is different. So the signal they're sending to you might be different. Does that make sense? Okay. So when qi is disturbed, so there are different kind of disturbed qi. So excessive qi stagnations, uprising qi, or qi sinking, or qi closure, or qi leaking. These are the pathological ones, right? Something is wrong. Okay. So when qi is too much, what is going to happen? Anxiety or anger, right? It's like boom, right? Because your body always looking for homeostasis. It's an internal balance, right? If it is not enough, your body actually very smart. They either want to shut down or they want to take out, right? They're looking for balance without looking for you. They just don't know how. Right? And so naturally, so you'll see some people, I work with some kids with ADHD, right? And then so what happened to them is they're always moving. They just like couldn't concentrate, right? So from TCM's point of view, their blood is not enough, so they cannot settle, right? And then they couldn't sleep well. And the chances are they have a liver and also kidney concerns. Right? And then that will be more in the TCM part, because liver is in charge of your mental health, your hormones, your also what else? Emotions, immunity, yes? Immunity, right? Okay, and then your blood, right? And then I'll tell you a secret time. In a day, we have 24 hours, right? Every hours, we have a different organs they are on duty. Ooh, funny, eh? Okay, now, the key thing is, between 11 to 1 midnight, okay? 11 to 1 is the gallbladder time. 1 to 3 is your liver time. And they say, what does that mean? Meaning, please don't stay up. Okay? Don't stay up too late. Okay? Because your blood is producing at that time. If you don't sleep, what happened? 1 day or 2 days, it's okay. But long enough, you're losing your blood. And then you lose your mind. Okay? Alright. So when you work with the shift workers, it's very hard for them, right? Because they're shift workers, right? And then so it's even crucial for them. They have to adjust. And so when they come to you, very normal, depressions, anxieties, if you don't see the whole picture, so you're missing a big part. Right? And then that's many clients come to us and say, counseling doesn't work. Really? It doesn't work, right? It's only because if we could see a bigger picture, right? Counseling do works because we need to do work with most of people, not everybody, but most of people work. Right? Because once they learn the skills and tools and they practice. If you're in the school counselors, right? If you're in school, you know students are there to learn skills. If they don't practice, how do they get a good mark? They won't. Right? And they say teacher is useless. Really? Right? But you don't practice. Right? Okay, so it's a teamwork. Alright. So when you have a qi stagnations, again, qi stagnation meaning your qi is not moving. Stays at one place. What happened? Cause pain. Right? You feel like, ugh. Right? Distension. Right? So anything, and uprising qi is even more. High blood pressure. Right? Uprising qi is a qi disturbed. Right? And people get angry easy. And you heard about many cases. People say, if these people have drinking problems, these people need to go to anger management class. You heard about that a lot? right? Your PO, the PO always send this person to the anger management class. Why? Because alcohol damaging the liver, right? And the major energy and a major emotion stored in the liver is anger, right? And then so vice versa. You drink more, you can become more angry. And then you're angry more, you drink more. Right? So we need to block that. We need to break that circle, right? Okay. So chi leakings. Okay. Now what happened to the blood? What if there's a blood deficiency? Blood deficiency. So blood deficiency we have.
So what are the symptoms? Pale complexion? No choice.
No choice. Well,
blood deficiency.
my accent maybe people don't understand totally. Blood deficiency, pale complexion, dizziness, palpitation, insomnia, light-colored lips and nails, scanty and light-colored menses.
Yeah?
Yeah, that's okay. Thank you. Yeah. Okay. Does that look familiar? What was that related? Close to depression. Again. Right? Okay. Anything deficient, chi deficient, blood deficient, very easy. Cause feeling depressed. Right? Because not enough. And depressed, what happened to depression? They don't want to move. They feel so tired. Of course, your body don't have enough energy. How would they want to move? They don't. Your body very smart. If you don't have enough, of course you rest. Right? So that's your natural function. I'm not saying depression or anxiety is natural and normal, but I want you to see this in a different perspective too. Okay? And disturbance of the blood, what happened? Blood stasis, you bleed, right? And then detentions or abnormal masses, right? Okay? Yes?
I was interested in insomnia. I would have thought that would be a disturbance as opposed to deficiency.
Yes.
Sorry.
Yeah, that's okay. Yeah, go
I
ahead.
figured it was loud enough.
Yeah.
No, I was just curious with the insomnia. Why, if lack of energy, why insomnia then?
Good question. Very good. Anyone has a similar concerns? Why is it insomnia? The reason why I highlight it is because blood is the yin part, right? If we understand from the previous one, the chi is the yang part, okay? And blood is the yin part, okay? So when you don't have enough yin, what happens? Is your chi too much? And your energy is too much. And then you cannot sleep. You're up running, right? Always remember, your yin and yang always together, right? If you have, they are not separated. They are together, right? So imagine, pick this into the picture. Say, everybody, you have boiled water before? Yeah? Okay, in your pot, there is water. And then there's a stove. Okay? Good. So the stove, the heat is the fire. It's the yang part, it's the chi. Okay? Now, the water is representing the blood and fluid. Right? When the blood is not enough, and then your heat is still up, what happened? Boiling. Right? So whole night, I cannot sleep. I just can't. I cannot settle. Does that make sense?
Yeah.
Yeah? Okay. So yin and yang, blood and chi, they're always, and fluids, they're always combination. Your patients or clients, they are sometimes imbalanced. It's just which part is lacking, right?